Those variants have public health officials in Toronto on edge. We have more on that from Eagle News correspondent Joshua Santillana.
Dr. Eileen De Villa, Toronto Canada's Chief Medical Officer of Health, gave an update on the city's COVID-19 cases Wednesday, as well as its variant of concern cases. Take a look.
Today, I'm reporting 389 new cases of COVID-19. 30 people have been admitted to hospital, bringing the total to 351, and 63 people are in the ICU. Sadly, I'm reporting one additional death. There are 72 confirmed variant of concern cases in Toronto. 71 are the UK variant, B.1.1.7, and 1 is the Brazilian variant. 710 cases have screened positive for mutations of interest and are expected to be confirmed as variants of concern.
The variant of concern cases are becoming especially alarming to some Torontonians. Toronto Public Health is working with 8 local schools that have been linked to these cases. At least one person in the following schools have tested positive for a COVID-19 variant of concern: Beverly School, Danforth Collegiate and Technical Institute, Yeshiva Yesodai HaTorah, Gulfstream Public School, the Toronto Cheddar, Helen Catholic School, Dante Alighieri Academy, and Our Lady of Lourdes Catholic School. Staff, students, and parents or guardians in the Toronto District School Board have also responded to a survey on their feelings towards health measures being followed in schools and their mental well-being. The survey shows that 20% of staff reported feeling safe at work from contracting the virus, 30% of staff were satisfied with COVID-19 related health measures placed in schools, and 7 out of 10 staff reported experiencing burnout and anxiety as a result of their jobs. In regards to students, 40% reported often feeling lonely, 50% reported feeling nervous or worried, and 60% reported feeling bored and under a lot of stress. However, 84% of students said that they learned better during in-person classes as opposed to virtual learning. In response to a question regarding the increase of variant of concern cases in schools, and if it is linked with the re-establishment of in-person learning, this is what Dr. De Villa has to say.
So at this point, David, I would say it's early to say that. We know that as people interact with each other, and that includes schools, that there is the opportunity for virus to spread and to transmit within settings. Any setting where there are people together is an opportunity for virus to spread. So certainly we expected that as schools returned to in-person learning, we were expecting that we would see cases within those settings. And in light of the fact that there are variants of concern in the community, we expect and we should expect to see variants of concern within schools. I think the other piece that I would offer is that right now, knowing what we know about the presence of variants of concern in our community, we are treating every case out of an abundance of caution. Every case that arises within the context of a school will be assumed to be a variant of concern until proven otherwise. And again, that's being taken out of an abundance of caution so that we can create the safest environment possible within our school settings to allow our kids as much as possible that benefit of in-person learning.
In Toronto, Canada, Joshua Santillana, Eagle News. We live in interesting times.